AOT has already been in existence here in our county for a little bit over 3 years. It's already a pathway for family members, loved ones, law enforcement, other people in the community that might identify a client, a person who needs mental health treatment, but that person is resistant to it. We do a lot of assertive outreach and engagement and try to convince that person to voluntarily engage in the treatment. If for whatever reason our efforts don't work, then we have the ability to petition that person and have them go to AOT court. CARE, on the other hand, puts that process in reverse. So what CARE does is that it allows both BHSD as a department, but also other community members, where they could kind of skip the outreach and engagement process with BHSD and petition directly with the court. They would have to meet certain criteria and provide certain documentation and evidence to prove that the client meets criteria.
Different types of clients that CARE Court provides services for really ranges, and there's a perception that the CARE Act targets the unhoused population, but that's quite the contrary. Based on our data, we've served folks that are unhoused and also folks that are, housed as well.
Once the team receives a referral for an individual, we typically start by reaching out to the referring party to gather a little bit more history and information, maybe some tips on how to engage with this individual, where they might be located, what's worked and not worked in the past. And then we assign the referrals to a clinical staff and then usually a peer support staff to go out in a team to engage in outreach to these individuals.
It's hard to locate folks, especially if they're unhoused, because then we are just searching, pretty much all of Santa Clara County looking for them.
Many of the folks that we serve are unhoused, so they don't have cell phones, they don't have their IDs, they don't have, a good support system. And so we're really just trying to locate them first and then just try and exactly what Yesenia said, meet them where they're at.
Once they've located the individual, the team approaches, they introduce themselves, let them know why they're there, let them know that they're there to help connect them to behavioral health services, but also provide resources and other support that they might need. Sometimes we get individuals that are like, they don't want our help. On those occasions, we do tell them, okay, we'll be back. Is there anything you need when we return? Sometimes it takes, several outreach attempts before they'll open up and trust us a little bit.
That might take a long time. With some people, the process could take a couple of weeks. For others, it could take 3 or 4 months. As long as we're kind of getting some progress, we'd rather get people to engage voluntarily than force them through a court process, right?
Sometimes it takes multiple times, in multiple attempts to kind of figure out what is the best service for them.
People have the impression that our team is gonna, wave a magic wand, connect the individual and do it in, a week or something like that. And it takes a lot of time to build a relationship with somebody.
We try to connect them to a higher level of service that will meet their need, that can go out into the community maybe or meet with them more often. So we really treat each referral that we receive on a case-by-case basis. We keep working with them until either they refuse services multiple times or we successfully link them to the appropriate level of service that they need.